When it comes to children and their first teeth, some of us adults kind of think, and I do know in the old days it was definitely like, well, never mind, they're coming out. 5 years later, they're gone, new ones come out, and apparently that could be a recipe for disaster for that kid. Tell us about it.
Yes. Well, even though we do keep our baby teeth or our deciduous dentition for a fairly short period of time, it's very important to the child's general health, to their nutrition, that those teeth be kept in good shape. If they start to decay or start to have problems and those problems are not corrected, this can have a definitely negative effect on the child's general health and on the subsequent adult teeth that will be coming in after the baby teeth. So many times a patient will say to me, well, why are we fixing this tooth? It's only a baby tooth. And my answer is that it's still a tooth. It has roots. It can cause the child a great deal of pain if we don't take care of it. Plus, if there's an infection with this tooth, it can definitely affect the tooth bud of the adult tooth growing below it. So those are some of the reasons that we want to always maintain even the child's dentition.
Yeah, you're right. I didn't think about it because if the tooth hurts, the tooth has an infection, or even if it isn't hurting due to the gums or whatever, and that's just like with an adult. You have an infection and you poison the body.
Exactly.
Type of thing. And I guess if you lose a tooth too early on a baby, the baby teeth, I guess, if you lose them too early, could that, or if you don't pull them when it has to be pulled, basically if you don't maintain them the way you would maintain a nice forest, a nice garden, would that affect the growing of the second teeth and the permanent teeth so that maybe more orthodontic work is needed because they grow crooked or so?
Exactly right. That's why we try to maintain those teeth in the position that they're in. We even replace, sometimes if a child's tooth is lost too early, we put something called a space maintainer in to keep the space open for the adult teeth to erupt normally. So yes, that's very, very important. And if those teeth are either lost prematurely or not lost soon enough, it can lead to problems in the occlusion or the bite of the adult teeth.
Which means where the brace is longer and more expensive.
Yeah, exactly.
All right. Good. Dr. Pakman, thanks a lot. Bye-bye.
You're welcome. Take care.